Testosterone replacement is everywhere right now. Clinics on every corner, influencers talking about it like it's another protein powder. Men convinced that it's just that missing piece. Let's get something straight. TRT can absolutely be life-changing. It can also be the shortcut that is just hiding your bigger problems. If you are considering it, you need to understand exactly what you're getting into and what you're doing. No hype, no fear, just the facts. TRT is designed for men that have true hypogonadism. That means they have consistent symptoms, low testosterone confirmed on 2 separate early morning blood draws, not one random lab, 2. Measured correctly, symptoms do matter. If you also have low libido, persistent fatigue despite getting adequate sleep, you're starting to lose some muscle mass, you're feeling depressed moods often. If those things are all lining up with your confirmed low testosterone levels, TRT may be an appropriate tool. If the right man picks it, it can improve energy, libido, bone density, body composition. Those are real positive changes, but it is not a patch for your crappy lifestyle. So let's start talking about what the ads for TRT tend to skip. TRT can have an effect on fertility. When you start injecting testosterone, it's a signal for the brain to quit telling your testicles to produce it. This could shut down sperm production. If you're looking to have children now or in the future, this can matter. There are fertility preserving alternatives, but you have to know what you're doing, and the people you're working with must know what they're doing. Second piece is ongoing monitoring. TRT can increase your red blood cell count, can make sleep apnea worse if you already have it, and we need to be monitoring prostate health with the appropriate age groups. This is not just, time to take some testosterone and forget about it. It requires ongoing labs, it requires ongoing follow-up, it requires the competent supervision of medical professionals. Third, there is some cardiovascular risk, although the data isn't 100% on that. And the more they're looking at it, the less they're noting the risks, unless somebody is already having chronic, uncontrolled metabolic disaster going on in their body with chronic cardiovascular disease. It could add gasoline to that fire if you fall into that population. So we need to consider the things that you need to look at before you decide to use testosterone replacement as a tool. First, you need to fix your sleep. If you're not getting that consistent 7 to 9 hours of sleep, we're going to have trouble with hormone regulation. Lift some weights 3 to 4 days a week. Progressively overload. Cut off some of that excess body fat. Abdominal fat will suppress testosterone production. Quit drinking like it's a college frat party. Alcohol will wreck your hormone regulation and wreck your sleep and make you fat. See how that works? You need to fix your blood sugar if it's a problem. Fix your blood pressure if it's high. Look at your metabolic health. Look at those things for 3 to 6 months. Be consistent. Then retest. Many men don't have a true testosterone problem. They have a terrible lifestyle problem. And if you're not addressing those variables, then you haven't even earned the right to discuss having testosterone injected into your body. If you fix all of that and you still have confirmed low testosterone, which means under 300 nanograms per deciliter on 2 separate occasions, persistent symptoms, no reversible causes going on, and a clear understanding of implications for fertility, then TRT can become a powerful tool in restoring your overall health. But it's not a crutch, it is a tool. A tool to be used under professional supervision by a medical provider with proper monitoring and adjustments made carefully depending on lab results. It's not about chasing supra-physiologic numbers. It's about restoring normal physiology of the body. There is a big difference. The Dad Strong position is not for or against TRT. We are for men who are informed. We are for showing discipline in your lifestyle first. We're for meeting those standards of sleep, training, body fat, alcohol consumption. If you fix your sleep, you fix your body composition, you start training, you reduce your stress, and your 2 lab results still show low testosterone, now it's time to have that conversation. If you haven't done that work first, you need to do the work. TRT is not there to replace effort. It's there to support your biology when your biology is starting to slip. That is the big distinction. Unfortunately, many men walking into the TRT clinics are looking for the shortcut. There is not a shortcut. There's discipline, there's data, there's responsibility on your part. If you need TRT, do it correctly. If you don't hide from the work. That is the standard. Hold the line.